Good day everyone. Now I'm going to perform the proper procedure of occupied bed making for the purpose of giving the patient a clean linen and to avoid the spreading of microorganisms, then to avoid undesirable smell and to avoid bed sores, as well as to give the patient a comfort and relaxation. So before proceeding to the right procedure of occupied bed making, always read patient chart, know the diagnosis of the patient, and always read the doctor's order. So first, go to the patient's room, knock the door, greet the patient, introduce yourself as well as the patient. So, good morning ma'am. I am Arian Barba, your caregiver for today, and now I'm going to change your sheets for you to feel comfortable and relaxed, and for you to have a clean linen, and to avoid the spreading of microorganisms, as well as to avoid the undesirable smell, and to avoid bed sores and pressure sores. So, may I know your name, ma'am? When is your birthday, ma'am? Okay. How old are you, ma'am? Okay, ma'am. So, it is okay with you, ma'am? Okay. So, now, ma'am, I'm going to check your vital signs, ma'am. Okay, ma'am, your vital signs are normal and it's good. So, I ask permission, ma'am, to go to the station and prepare the materials and tools needed for the bed making, ma'am. Okay, ma'am, thank you. So, before going out to the patient's room, make sure to raise the side rails and lock the wheels also. So now I'm done preparing the materials and tools needed, and wearing my gloves or preparing myself. Then now I'm going to proceed to the patient's room. So knock the door. Hello ma'am, I'm back. Before we proceed to the right procedure of occupied bed making, make sure to provide patient's privacy by draping the curtains and locking the door.
And ask the patients if you want to defecate or urinate.
So first, we're going to untap all around. But before, raise the side rails and lock to avoid any form of accident. Then, position the patients to a lateral position by raising the hand and the other hand in the abdomen, then bending the knees. And lift the patient. Now we're going to roll the top sheets towards the patient's body. And the incontinent pad or the under pad towards the patient's body under the top sheet. Then the bottom sheet, roll it towards the patient's body under the incontinent pad or under pad. After rolling the sheets towards the patient's body, now we're going to clean the mattress. So our mattress is cotton, so we're going to use a dry washcloth. So we're going to strip off the dust all around. Make sure to avoid shaking. And after stripping the dust, use the 70% antiseptic alcohol or isopropyl. Then spray all around. And use another washcloth to pat dry the alcohol that we spray. Then done. So now we're going to change the bottom sheet with a new bottom sheet. So starting from the foot part up to the head part, so make sure to level the edge of the new bottom sheet and the mattress. Then drag it or pull it. Make sure to avoid any contact to the soiled linens with a new bottom sheet. Then drop the one side of the bottom sheet to the then stop. Stack as far as you could. And roll towards the patient's body. And we're going to put a new incontinent pad to the bottom sheet. And then make sure to level it to the patient's buttocks. Then roll it. Then place it under the bottom sheet. Then put a new top sheet starting from the head to foot. Then make sure to level the edge of the top sheet to the head part. Then wrap. Then roll it. Then drop the one side of the top sheet. Then tuck as far as you could. Make sure to stretch to avoid creases. Then roll the top sheet to the one side of the bed. And then we're going to position the patients to a supine position. Then position the patients from supine to lateral position while changing the top sheet. So now, raise the side rails and lock, and then position the patients from supine to lateral position by raising the hand and putting the other hand to the abdomen while bending the knees. And then turn the patients towards you. So now we're going to change the pillowcase of the pillow. So make sure that the pillowcase is wrong side out. Then get the pillow. And then pull the soiled pillowcase. Then set aside the pillow and make an improvised hamper. So make sure to place it in a wrong side out. Then get the top sheet. So roll it inward. Make a ball. Then put it to the hamper. Then roll the incontinent pad inward Roll the bottom sheet inward. Make a ball. Then put it to the hamper. And set aside the hamper. Now we're going to flip to the other side of the mattress using the washcloth or dry washcloth. So strip the dust. And always remember to avoid shaking. Then after stripping, use the 70% isopropyl alcohol. Spray all around. And use another washcloth or dry cloth to dump or pat dry the alcohol. Then change the pillowcase and put the pillowcase. Always remember to put the pillow or place the pillow far away from your body to avoid cross-contamination. And then, so place the opening of the pillow opposite to the door so that we can avoid the microorganisms from spreading, and place it to the patient's head. Arrange the bottom sheet by pulling. So we're going to tuck the head part. Make sure to tuck it very well. Then do a mitered corner. And tuck it. Then drop. Then tuck it all around. Then pull the incontinent pad. And position the patient back to supine position. So adjust the pillow. So arrange the top sheet. Pull it to the next of the patient. Then tuck. So lift the top sheet to the foot part. And make sure that the top sheet to the other side is level to this side. And if the patient is not sleepy yet, do a modified mitered or leave the top sheet hanging. So the patient is sleepy, and we're going to tuck all around. Part. After tucking all around, make a mitered. And do a flat to the foot for unconscious patient to avoid foot drop, and for the conscious patients to avoid discomfort. Dispose all the unwanted materials and clean the area, and now the patient is comfortable and it's done.